Hello, viewers. Welcome to this episode of Healthy India. For the last 2 years, we've all been talking about COVID-19 and its vaccination. The COVID-19 pandemic has taught us a lot about treatments, about prevention, about social distancing, masking. Another area where the medical field has learned a lot about managing disease or preventing disease is the area of vaccination. Before the COVID-19 pandemic hit us, there was very little awareness about adult vaccination worldwide, in particular in India. And now it seems to have turned the other way, where all the vaccinations are starting from the oldest age group and children are still to be vaccinated. So that depends on the kind of disease you're dealing with. But the truth is that COVID-19 is a great opportunity for all of us to focus on vaccination for adults. Is it really required? How important is it? And should we really be volunteering for adult vaccination once this pandemic is over? We're not discussing COVID vaccination today. You've heard a lot about that on TV and read a lot about that in the newspaper. So what is vaccination? Vaccination basically is when you stimulate the person's own body, our own body, to mount an immune response that will protect that person from subsequent serious disease. So for example, if you give a small dose of something toxic or a virus or a very small dose, that will stimulate the immune response of the body so that when the actual virus hits you, you're well prepared to tackle it. So it's utilizing the body's own defenses, preparing them for an attack by a virulent organism. That is the principle of vaccination. And I can't resist telling this short story about Jenner and the origin of vaccination and how smallpox was widely prevalent worldwide with 25% mortality. And I'm talking of the late 18th century, maybe 1796 or something, when Jenner noticed that in Gloucestershire in UK, he noticed that maids who got cowpox did not develop smallpox. And being of a scientific temper and thinking out of the box, over years of anecdotal evidence, he gradually built up a story by which when he infected people with cowpox, children with cowpox, they did not then fall prey to smallpox. So basically what it means is that cowpox being a less virulent cousin of the smallpox, if you get infected by a particular less virulent strain of the virus or of the same family of viruses, you will not develop the more serious condition. And that was a huge path-breaking thing in the history of human health. If you ask me, perhaps one of the biggest ever. And by 1802, it was already in India, the smallpox vaccination, but that's another story. But the truth is that's how vaccination for children started. And we all know about vaccination for children. We all take it for granted. We all know that our children are vaccinated when they're newborn, when they're infants, when they're kids. We don't think about vaccination after that. So let's go into that a little bit more. First, let me understand from our panelists, and let me introduce them first. We start with Professor Gagandeep Kang, whom you met before, and who is a professor in microbiology at the CMC Vellore, a well-known face in the media and in scientific circles, one of the pillars of India's COVID campaign. We have Dr. Madhu Gupta, who is a professor of community medicine at the well-known postgraduate institute in Chandigarh and has a particular interest in vaccination, in particular in adult vaccinations. And then we have Dr. Swaminathan, who is an infectious disease specialist and comes from Chennai and Bangalore, where he heads the Gleneagles infectious disease section. So people with tremendous interest and experience in this area will enlighten us about vaccination today. So before we go ahead, Dr. Gang, would you like to explain two concepts to us? I just said that you could use a small dose of the offending agent, or you could use a dead offending agent, or you could use a part of the offending agent to stimulate the human body. So what are the various platforms on which vaccines are developed? And secondly, to follow that up, is what is the purpose of vaccination? Is it to prevent disease, to prevent serious disease, to prevent death? That's a very important question that is often asked.
Thank you so much. I think you did an excellent job of explaining what vaccines are about. But if I can just reiterate, a vaccine could be a living organism, it could be a whole dead organism, or it could be part of an organism. And all of these can serve as vaccines. And then from Ebola onwards, we have had new technologies available to us for making vaccines where we give neither a part of the organism nor the whole organism. Instead, deliver the message to the body about how to make a part of the organism. This started with Ebola vaccines. Now everybody knows the SARS-CoV-2 vaccines, particularly the adenovirus vectored vaccine, which we have in India called Covishield. That was actually not the first viral vectored vaccine. The first viral vectored vaccines that we had were two vaccines for Ebola. We also now have in India the very first DNA vaccine for humans, and we have RNA vaccines. So viral vector vaccines, DNA vaccines, RNA vaccines all tell the body how to make a protein. In the more traditional forms of vaccines, we actually deliver the protein either as a part of the organism or as the whole organism. And when we do this, the body recognizes these proteins as being foreign and tries to throw them out. It can do that by blocking their ability to act. It can do that by killing cells that are infected with a particular agent. But largely, the vaccines that we have that are successful so far have mostly depended on the ability of the body to make antibodies. Antibodies are proteins, again, that recognize the antigen, the foreign protein, and then figure out ways of blocking it. That's all that a vaccine is. And vaccines don't actually prevent infection. They require you to acquire the organism, and then they block the action of that organism, particularly if the organism is one that comes in through a mucosal surface. In some very special situations, the vaccine can actually shut down the entry of the organism as well, and that is a situation called sterilizing immunity. But very few vaccines give us sterilizing immunity, and no vaccines for diseases that enter through the gut or through the respiratory tract or through the genital tract.
Thank you, Dr. Kang. I'll move to Dr. Gupta now. So, we're going to talk mainly about adult vaccination, but we also know that childhood vaccination is very important. It's something that people of this generation just take for granted. That is just there. It's obvious. There shouldn't be any polio. There shouldn't be any smallpox. But it wasn't always that simple. And the fact that we have eradicated or almost eradicated those conditions is really a tribute to our healthcare system, which has delivered in some areas quite remarkably. What do you think are the important vaccines now for children? And, what is India's story in this? Where are we placed with smallpox, polio? And one line I'll want you to talk at the end about the BCG vaccine, which is always discussed.
Yeah. Thank you. Thank you, Dr. Mithal. So basically, you started with smallpox. So I think that was the time I'm talking about late 1970s when we were working to eradicate smallpox. And that was the time when India first talked about immunization as a whole for the country. And that was a global commitment. That was part of the global commitment. So in 1977, we saw the last case smallpox in India. And in 79, we eradicated from the world. So that was the time because we had the system in place that we thought that India ministry thought that we should have an expanded program on immunization. And in 1985, then we introduced universal immunization program. So initially we started with 6 vaccines, which were the major public health problems for under 5 children and one of the major causes of mortality among them. And these included BCG, as you have already pointed out, then diphtheria, pertussis, tetanus, measles, and then polio. So we started with these 6 vaccines. And for a very long time, we continued implementing these 6 vaccines. And there were oppositions to these vaccines also. There was community who were not ready to accept that. But ultimately, immunization became community's program. It became the program of the people. So now when a child is born, mother would say, give vaccine to my child. They demand for it. So I think from that perspective, we have actually shown a very good example wherein we can implement so many doses, about 27 million doses every year to this new population, which is adding to our birth cohort. So in last 10 years, I think with the commitment, political commitment, we could introduce some very good newer vaccines. So we were part of that, and I worked with Dr. Gagandeep on that, and how we convince the government, okay, that we have to reduce further mortality of these under 5 children. And this is one of the effective strategy. Immunization, if you see, it is the most effective, cost-effective strategy available to prevent morbidity as well as mortality. So then we introduced this pentavalent vaccine, Hib vaccine, which had Hib. So hemovirus influenza type B vaccine and hepatitis B along with the DPT. Then we introduced rotavirus vaccine because pneumonia and diarrhea were the major causes of death among under 5 children. And I'm very proud now we have pneumococcal vaccine as well for the children, which also accounted for large number of mortality because of pneumococcal pneumonia. And then IPV, because that was part of endgame polio strategy. So, and rubella, measles and rubella is another addition. So, as far as our childhood program, vaccination program, if you talk about, I would say it's a huge success. And with this intervention, we could actually eliminate and rather control so many diseases, infectious diseases among children, and we could meet our sustainable development goals related to health, under 5 mortality, especially, or infant mortality. So it's a great success, and I think we could very easily start up with the COVID-19 vaccination because we had so much experience of implementing the vaccination for the country. So I think, and we actually, COVID-19 is on vaccination program is being implemented through these centers. Although the platform is different, but yeah, we were confident and we will do that.
So that's great to learn about the background. I think it's important for our viewers to understand what we often take for granted takes years of science, research, policy change, and finally implementation before it actually makes a difference on the ground. So it's good to keep that in mind. We think of why not more vaccines? Why not this? And we look at what we've achieved with COVID vaccination is also quite remarkable. But having said that, there's always room for improvement. There's always room going forward. And one of the areas where we haven't perhaps done that well before COVID-19 is the concept of adult vaccination. So this adult vaccination concept is still relatively new in India. You'd be surprised among doctors also. It's not something that is completely acceptable, and people don't just jump at the idea. If you say your child is not going to get this vaccine, there'll be a hue and cry. But the same thing doesn't happen for adults. So I request Dr. Swaminathan to enlighten us on the importance of adult vaccination.
Adult vaccination remains a challenge, not just for us, but even in developed countries where they have actual programs for use of adult vaccines. The US Institute of Medicine published a report which said that vaccine preventable disease related deaths is 300 times in adults as compared to children. So there are 300 adults dying for every child who dies of a vaccine preventable disease. And that's a sad statistic because most of this, if not much of this, is definitely preventable. And a lot of it boils down to influenza and pneumococcus. Now, if we look at prevention of disease, from a community perspective, the most important thing is sanitation. History has taught us that. After that comes in vaccination. The second most powerful weapon that we have in terms of public health is vaccination. And when we look at it in terms of adult vaccination, there are reasons why we do that. Adults, we know with age, our immunity slows down. And COVID has shown that to us very, very clearly. We know that those who have medical issues and those who are older are the ones who are most vulnerable and therefore have the highest risk of really bad outcomes, whether it's getting to a hospital, whether needing oxygen, whether going on a ventilator or even death. Now, this kind of data is available for other diseases, but unfortunately, we have not really paid attention to it because for one reason, it's not as glamorous as, say, cardiac disease or cancer, although the deaths are actually quite comparable, if not as bad. So is it a sensible proposition? Now, there is data for this from the Canadian government. Back in 2006, they actually published data because in Canada, the government pays for both the healthcare and the vaccination. And they put out a very simple statistic. As far as the influenza vaccine campaign is concerned, for every dollar that they spend, they save $45 in healthcare expenditure. Nowhere else do you get such an incredible return on investment. 4,500%, if you would like it as percentage, or in simple terms, 45 times. $1 in, $45 out is incredible cost savings. For pneumococcal vaccine, it's $1 in and $8 out. So adult vaccination is actually a cost-saving proposition because it reduces morbidity and mortality, that is sickness and death in the adult community by multiple mechanisms. It's not just by reducing influenza, but also by reducing all kinds of other associated events. And therefore, it actually reduces sickness and bad outcomes in older adults. Unfortunately, this has not even reached a lot of our healthcare providers. I suspect some of it is because it's not in the curriculum. While there has been so much emphasis on primary vaccination, which is absolutely critical, I mean, there's no two ways about it. Pediatric vaccination is the cornerstone of our healthy childhood. Unfortunately, that amount of focus has been missing as far as adult vaccination and adult protection. And that goes back to our education system as well. And as you beautifully pointed out, even our own healthcare providers and our colleagues in healthcare are sometimes unaware of how important this is. And unfortunately, that's remained a reason for it to kind of be the ugly stepsister of pediatric vaccination. And I hope that COVID will change some of these mindsets.
Yes, I think it will. And we need to sort of hang on to this and push. And, there's always some gain from all the pain. So perhaps if we push hard for adult vaccination, we can get that program off the ground. There are also challenges. Kids are easy to access, in schools and other ways. You can sort of just go there and line up children and just give their vaccinations. Or, there are many ways to do that. In adults, to get them together, to get them to agree is probably also a big challenge. That also, in addition to our own lack of motivation and lack of push, perhaps the logistic challenges might be a little greater in adults, although as we see in COVID-19 vaccination, when people are actually concerned, then they do come forward very easily. So it's also about how much importance doctors give to it. There's an old Chinese saying that a good physician treats disease, a superior physician prevents disease. So, but that's not the case. It's quite the reverse in the medical fraternity. The glamour that goes with treating actual disease is far greater than being on the preventive side. I'll ask Dr. Gupta once about What is the current status, the official, like you explained so beautifully about childhood vaccination? What is the status of adult vaccination programs in India as a program?
So, as a program, there is no program for adult vaccination. Unfortunately, we do have for pregnant women. So, because pregnant women is again because they are related with child, I think. So, it's maternal and child health. So, we are giving tetanus and diphtheria to the pregnant women. That is part of the program. Until 16 years, we do have this tetanus and diphtheria for them. Apart from that, for other adults, there is no such program. And HPV, one of the state human papillomavirus vaccine. So that was just one state from the state budget only they had initiated. But there is an Association of Physicians of India, API, who recommends it, who recommends that this vaccines for adults should be there, and they have a guidelines for that. So that includes measles, mumps, rubella, diphtheria, pertussis, tetanus, influenza vaccine, typhoid vaccine, pneumococcal vaccine, meningococcal vaccine, HPV vaccine, and chickenpox, varicella vaccine, hepatitis A and B, and of course COVID-19 now. So they are recommending it, and worldwide there are such associations who are recommending it. Like in US, as Dr. Subramanian has already mentioned, that there is definitely a program for adult vaccination. I think we also now need to follow that. We also need to recommend and have some advocacy with the ministry. Now that we are more prepared, we have more experience of immunizing adults. So cost could be an issue, like how the government will procure, but it need not be universal. Maybe some of the population who are at a higher risk, like for typhoid vaccine, it is seen more in urban areas. Like in those settings where actually the disease burden is very high, we can think of immunizing those populations and protecting them. Healthcare workers, so there are certain occupational hazards where these vaccines should be given as part of the program. So that is what I feel.
So it's very important for us to note here that there is no formal program for adult vaccination. It's fraught with challenges because you have to define at-risk populations. It has economic implications, but I guess that's the way forward. Step by step, I guess more and more programs should be included in adult vaccination programs to prevent, not just to protect the health of our population, but in very crude terms, as often policymakers think, to reduce economic burden. And I think economic burden of health disease is a huge factor that can be reduced very significantly by the judicious and correct use of adult vaccination. And we now take a short break. We'll be back for more. Welcome back after the break as we continue our discussion on vaccinating adults in India. Dr. Kang, we were trained to think you've got your vaccine as a kid and you're protected lifelong. But then we hear viewers are asking this, what is the story of repeated vaccinations? How long does vaccine-induced immunity last? There are some conditions where you say you get it every year. There are others where you say, no, it's okay lifelong. In some, you say you require a booster. In some, you say you require 3 doses. Can you explain this whole rigmarole of the duration of immunity provided by vaccines?
Well, I think the need for doses of vaccine, when they are given and whether repeat doses are required, depends on the organism, depends on the person that the organism infects, and depends on how good a vaccine we have been able to make. So if we take an example of influenza, for example, our influenza vaccines are terrible. We make a new vaccine. WHO has to have a meeting every year to decide which vaccine will be used in the Northern Hemisphere, another meeting to decide which vaccine will be used in the Southern Hemisphere. You're basically predicting what you think will be the influenza viruses that will be circulating 6 months from the time that you make the prediction. And you have to do this because the vaccines that we have are not very good. They give you some amount of protection. In a good year, you'll get about 60% protection against severe disease. In a bad year, you may get almost no protection at all. So that's why for flu vaccines, we have to give vaccines as frequently as once a year. Maybe we'd be able to build up some immunity and get away with alternate years, but that's still something that is being discussed. If we had a better flu vaccine, if we had what people are looking at now, which is a universal flu vaccine, the goal would be to immunize much fewer times. Now, if we look at other vaccines that are given that are better vaccines, then you don't need to give them as often. So take, for example, tetanus is a very good vaccine. You give your primary immunization series for tetanus, and then you think about a booster every 5 or 10 years. So it really depends on both the vaccine as well as the people and the times at which disease occurs. We vaccinate pregnant women, as Dr. Gupta had pointed out, with the tetanus-containing vaccine because we want to protect the child from neonatal tetanus. Mothers transfer their antibodies to the child. So there's discussion now about what else can we use in pregnancy. So it's really who are you protecting, with which vaccine, at what point in time, and the quality of the vaccine that determines the frequency with which we need to use them.
So you did say that the influenza vaccines are not that great, or is it the virus that's too smart and it keeps changing too fast for us to keep track of the changes and build vaccines accordingly?
Well, as we've learned from SARS-CoV-2, yes, RNA viruses are smarter than DNA viruses because they change more frequently. In fact, for an RNA virus HIV, we have not managed to make a vaccine as yet. With influenza, it is a clever virus because it carries its genome on 8 separate strands of RNA. And when you get an infection with 2 strains of influenza, you can get daughter viruses that look nothing like the parent viruses. So that reassortment happens when you have what is called a segmented genome, and that drives diversity in influenza and is a major reason why we need to keep changing the vaccines that we use. But there are other RNA viruses with segmented genomes where that doesn't happen.
We'll crack that code. I'm sure people like you will be able to crack the code of influenza sooner rather than later. I come to you, Dr. Swaminathan. Now, in practical terms, we have to tell our viewers, what should we do with the influenza vaccine? Who should be taking it? Which time of the year? How should one go about it?
The first point, who should be taking it? Obviously, those who are most vulnerable are the ones with the maximum benefit. In the Western world, obviously, they give it to everybody who walks in and as many people as they could jab. But in terms of return on investment, there are 2 groups of people. One is healthcare workers. In the Western world, it's almost mandatory to take the flu vaccine. It's very difficult getting exemptions today because healthcare workers can end up transmitting influenza to the most vulnerable patients and other populations, which would never be a good thing. Therefore, healthcare would automatically be a required vaccination. As far as the general public is concerned, it is everybody 65 and older and those with significant medical comorbidities, because in this group of people, influenza carries additional burden in terms of poor outcomes, both short-term and long-term. So very simply put, if you are 65 and over, or if you have a medical comorbidity like cancer, significant diabetes, kidney failure, liver failure, heart disease, these would all be indications to take the influenza vaccine on a yearly basis. The more difficult question is, when should they be vaccinated? See, the hemisphere is a curious thing because it's not really hemisphere per se, because we seem to be fitting in more with the southern hemisphere in terms of how the virus moves. And But unfortunately, again, within India, being a subcontinent, there's a little bit of heterogeneity. So the influenza season is a little different based on where you are. Tamil Nadu and Jammu and Kashmir would be a little different because the flu season is a little later. For most of India, you track it by the monsoon. So anytime from June onwards, the flu season would start for most of India. So the time to get it would probably be March, April kind of thing. But for Tamil Nadu and Jammu and Kashmir, the flu season kind of starts in December. So November would probably be the best time to get it. Again, in the Western world, they make certain other distinctions for those who are most vulnerable, like organ transplant and things like that. They do use double dose and stuff like that. But at least getting one dose of the vaccine would probably be a good idea. Simply put, if you're not sure, just get the vaccine whenever you can. Because waiting for the right time actually results in a lot of people missing the vaccine. So I would request that we just go ahead and give the vaccine at every opportunity that we have in hand, rather than wait for the right time, because waiting for the right time means there's a lot of loss of opportunities, and we just leave vulnerable people in harm's way when we could have done it. So that's probably the most sensible answer that I can think of.
So very quickly, just a one-line answer. A lot of patients say, well, this is the last year's strain. Should I wait? Should I wait for the new vaccine to come out this year? When should I? So is there any clarity on that?
Well, the new vaccines usually come out in April and November. So yeah, if you're getting your vaccine, just wait for the new vaccine to come out in April and take it. If you're in Tamil Nadu and Jammu and Kashmir, you wait for the November vaccine to come out and take it. I think that's as simple as that. But even with an older vaccine, it's not that there's zero protection. But waiting for the new vaccine probably makes a little bit of sense.
Thank you, Dr. Swaminathan, for very valuable tips for our viewers. And very briefly, Dr. Madhu Gupta, about HPV. People know very little about that. Can you just summarize for us what you'd like to tell the viewers? Yeah.
So HPV, human papilloma virus. So this is one of the virus which is implicated in causing cervical cancer and urogenital warts. So it prevents that. The important point is the vaccine should be taken before the sexual activity, because this is preventing that. So the good time period is for the adolescents whom we should be giving this vaccine between 9 to 13 years. So there are different types of vaccines like quadrivalent, which is available, Gardasil. So that vaccine, 2 doses in a gap of 6 months can be given to these children between 9 to 13 years. And if the age is higher, like more than 14 years, then 3 doses are to be given, 0 dose, then after 1 month and at 6 months. So they can take the vaccine, and better would be to take the vaccine before the sexual activity. So up till 26 years, even up to 45 years, you can take the vaccine. So, but for adolescents, it is the best.
So you're advising adolescents to go for vaccination, for HPV vaccination?
Yes. Boys and girls both.
Yes, boys and girls both. I come to you, Dr. Kang, again, and we talk a little bit about a condition about which people are a little bit more aware than they are about HPV, and that is hepatitis. And hepatitis vaccination is one of those that is widely practiced in hospitals, at least, with sick patients, and especially by nephrologists and gastroenterologists. They're, liver disease hepatologists. They are very particular about vaccinating their patients. So we want some highlights for our viewers about hepatitis vaccination.
Well, I think the first thing to point out is that there's more than one hepatitis virus, and we have 2 excellent hepatitis vaccines. The hepatitis A vaccine has traditionally not been given in India very widely, because the belief is that if you live in an unsanitary environment, you'll acquire the hepatitis A in any case, and that will allow you to develop immunity. However, it's important to understand that when you belong to a higher socioeconomic group, your chances of acquiring hepatitis A do decrease, and it may be valuable for many of your viewers to think about vaccinating their young adults and adolescents. If they haven't gotten hepatitis A vaccine, they should consider it. Where hepatitis B vaccine is concerned, it is now included into the program because it is part of the pentavalent vaccine that is given to children as part of their routine immunization. But there are gaps because before pentavalent was introduced, not every state had a hepatitis B vaccination program. So therefore, there is a large section of adults in the country that may not have received this vaccine in some states, and it is important to ensure that they get it. These vaccines are cheap, they are safe. In fact, the vaccine revolution in India really started with our ability to make a very affordable hepatitis B vaccine. And you just need to take 3 doses of the vaccine if you haven't received it before. And these vaccines are really stellar performance. Of course, if you're immunocompromised, as you pointed out, you might need to monitor whether the vaccines have worked or not.
Thank you, Dr. Kang. And we now take a short break. We'll be back for more. Welcome back after the break as we continue our discussion on vaccination, particularly for adults today. We'll now move to pneumonia vaccination. Again, a slightly complex area because there are 2 pneumococcal vaccines that are available. And I'd request Dr. Swaminathan to explain to our viewers about the need for pneumococcal vaccination and very briefly, which vaccine goes where. I understand that it's not always that easy to explain that, but a broad idea of both the vaccines that are widely available.
Pneumonia has traditionally been called the captain of the men of death. Since ancient times, we know pneumonia is an important cause of death in the older adults. And therefore, vaccination to prevent the disease actually makes a lot of sense. We do have 2 very good vaccines. The one is an older vaccine, which is the polysaccharide vaccine, which has been available for almost 40 years now. The other is the conjugate vaccine, which is a protein conjugate vaccine. It's a relatively newer technology. Obviously, there are differences between the 2. The older vaccine is not as immunogenic. It is protective against severe disease, but it's not very effective against milder disease. Number 2, it covers more serotypes, 23 serotypes. And obviously, the effect of it is probably not as long lasting. So in some situations, at least, we do recommend a second booster. The conjugate vaccine is newer technology. Therefore, it does give you more robust immunity, which lasts longer because it gives you both T cell and B cell. Everybody is talking about all this thanks to COVID. And it has better long-term immunogenicity, like I said. Unfortunately, it only covers about 13 serovars, the one which is applicable for adults. Children have another 10-valent vaccine also available. Obviously, now the government is starting to move towards vaccination for the children with the protein conjugate, the conjugate vaccine. But as of right now, since India is primarily unvaccinated as far as the pneumococcal vaccine is concerned, using the conjugate vaccine in adults does make sense. In the Western world, the recommendation is a little soft for the conjugate vaccine because there is a lot of use of conjugate vaccine in the children. Why this is so? As we start using more and more of the conjugate vaccine in the children, we tend to extinguish those types of serotypes in the community, and therefore adult disease due to that starts falling. Since we don't have that pressure in children, they still form the bulk of the disease in adults. Data from CMC shows that about 65-70% of the circulating pneumococcal varieties are covered by the 13-valent, and an additional about 15% is covered by the 23-valent. So as of right now, the current recommendation would be to use the 13-valent upfront, and then maybe a year later, use the 23-valent, and you probably don't need to get booster doses of this ever. Now, obviously, it still goes for the vulnerable age group, which is 65 and above, and those with serious medical comorbidities. For others, the benefit is probably not enough to justify the approach at this point of time.
So for the kind of patients I treat, who are almost always diabetic and often above 60 and often have accompanying hypertension, history of infections, both influenza and pneumococcal vaccination should be a must.
Absolutely.
By and large. Well, it is in our clinics, but we're not able to propagate it, the way we would like it to be propagated. So I think that's an area that really needs a lot of hard work. As Dr. Madhu pointed out, the API has guidelines, but I think we all need to push a little bit more in our respective micro communities of pulmonary medicine, infectious disease, endocrinology, wherever, to convince more and more of our colleagues to push for vaccination so that more and more patients can be spared the agony of actually contracting the disease. One of the things we sometimes, forget is something as simple as zoster. Herpes zoster, deceptively simple. Everyone will have some idea of herpes zoster. They had a line of eruptions here in the chest somewhere, and the eruptions became okay, but the pain persisted, and sometimes the pain can be really, really terrible. And I really think that very few people are aware of the fact that there is a vaccination for zoster too. Dr. Madhu Gupta, would you like to enlighten the viewers about that?
Sure. So definitely there's a vaccine available, and it is for the children as well as for the adults. So here we are talking about adults. So there is a recombinant vaccine which is available for adults, and another is a live attenuated. But the recommended one is for the adults is the recombinant vaccine. For that, 2 doses are to be given in the interval of 4 to 8 weeks. The vaccine is given subcutaneously. So for children, rather, I would not recommend, rather I would say that children should get the infection naturally. But IAP definitely recommends that children should also be given this vaccine to prevent chickenpox infection. Because once they do not get during their childhood and they get it later, the morbidity is much severe. So that is why they are recommending that children should also be given 2 doses of vaccines during their childhood. But for the adults, there is a vaccine available, and it can be given from 19 years onwards. So there is a recommendation. CDC says 19 to 50 years, you can give this live attenuated vaccine. But after 60 years, recombinant vaccine, 2 doses are to be given to prevent herpes zoster. So because that could be very painful. That could be very painful. Yeah. And for the pregnant woman also.
Yeah, I mean, herpes zoster, of course, regardless of the fact that it can cause serious disease, including encephalitis and other things. But the fact is that the post-herpetic pain can be a serious morbidity in the sense that it can affect quality of life and functioning of people for weeks together. Exactly. So if that can be prevented, certainly in those who are more vulnerable, we should consider that. Dr. Kang, there are some people who should not be vaccinated amongst adults who are clearly no, they shouldn't be going for vaccination. Can you think of any such groups, or which are the groups which should not be vaccinated?
Well, the first thing is to think about which vaccines we should not be using in certain groups of people. And wherever you have a live vaccine, those vaccines should not be used at all in people who are immunocompromised, because you're setting up a situation where that person then might wind up getting an infection from the vaccine itself, where the virus continues to replicate for a long time or develops disseminated disease. So wherever you think about a live attenuated vaccine, those vaccines should not be used in immunocompromised individuals. An example of that is oral polio vaccines. When given to people who have immunodeficiencies, you can wind up with people who will continue to shed the vaccine poliovirus, which can revert to neurovirulence for years, even decades. This has been documented, and those people need to be monitored. Measles, mumps, and rubella vaccines, again, are vaccines that should not be used in people who are recognized to be immunocompromised. So we need to be very careful with the use of vaccines. Inactivated vaccines in general are safe. Subunit vaccines in general are safe. Live vaccines are not.
So, Dr. Kang, supposing you were to draw up a grid, I mean, I'm not asking you to make a full white paper on this show, But if you were to draw up a grid of prioritizing vaccinations for adults in India, so if we were to go by young adults, we're leaving pregnancy out for the moment, young adults, and we are looking at older adults, how would you look at that? Which vaccines do you think we should really be pushing?
For young adults, let's start with typhoid. This is a disease that is extremely prevalent in urban India, but is not seen in other parts of the world. And it's time that we used our science, our data for our decisions. As Madhu pointed out, HPV vaccination for people who are eligible and have not yet received it. And then we need to think by profession what the risks are. So all healthcare workers, we should be looking at whether they've had varicella vaccines and looking at whether they receive influenza vaccines on a regular basis. At a minimum, that's where I'd start.
Thank you, colleagues, for explaining to our viewers so simply about the need for adult vaccination. As we know, vaccination probably is one of the highest forms of medicine because you're actually preventing disease. And many a time, if you can't prevent the disease itself, you can definitely prevent serious complications or outcomes from the disease, as we have seen so consistently in the COVID-19 pandemic. One of the examples I often use to explain to my patients about the need for vaccination and the efficacy of vaccination during the pandemic was the fact that getting a vaccine is like wearing a seat belt or wearing a helmet if you ride a two-wheeler. It does not mean you won't have an accident, but you're much better prepared to tackle the outcomes, and the outcomes will be much better. So therefore, do not think of vaccines as a 0 or 100 kind of phenomenon. Once you've taken a vaccine, nothing's going to happen. That's not true. You will still get disease. You might still get disease. But the truth is that the disease will not be as severe and as serious as it would be if you were not vaccinated. I think this is a very, very important message that's coming out. And, talking of vaccination, just before we close, India had a concept of vaccination maybe 1,000 years ago. In medieval times also, there was vaccination practiced in India, China, Turkey, Egypt, using different ways of inoculating people with small doses of the same infection, so to speak, and therefore build their immunity. But actual vaccination in India took off when the smallpox vaccine reached here from arm to arm, reached Bombay, from child to child, and then from Bombay, and for a good 2 decades, it was actually still being, a liquid taken out of a blister and scratched under the skin of the next child. And an amazing success story of what vaccines can do. Thank you, colleagues, for providing valuable information to our viewers. And thank you, viewers, for tuning in every week to Healthy India on Sansad TV.